Hello, and welcome to today's Facebook Live Q&A on NIH's Safe Return to School Diagnostic Testing Initiative. I'm Dr. Allison Cernich, Deputy Director of NIH's Eunice Kennedy Shriver National Institute of Child Health and Human Development. The testing initiative is a national effort to address the needs of children with unequal access to COVID-19 testing, as well as those facing barriers to attending school remotely. The research is part of NIH's Rapid Acceleration of Diagnostics Initiative's Underserved Populations Program, also known as RADx-UP, which focuses on addressing health disparities in the COVID-19 pandemic. Loss of in-person schooling disproportionately affects minorities, socially and economically disadvantaged children, and children with disabilities or medical conditions. Researchers in the Return to School program are evaluating how access to COVID-19 testing can safely return these students, teachers, and other staff to schools. In planning these projects, the researchers worked closely with school officials, parents, and other community leaders to ensure their work met the unique needs of each community. Today, I'm delighted to be joined by Dr. Kenesha Zimmerman, a pediatric intensive care physician at Duke University, and Ms. Ms Pryor, principal of the Carter Community Charter School in Durham, North Carolina. Dr. Zimmerman's project focuses on serving Black and Latino communities in Durham. We also have Dr. Christina Gurnett, a pediatric neurologist at Washington University, and Ms. Ellen Birch, a special education teacher in the Special School District of St. Louis County, Missouri. Dr. Gurnett's project focuses on schools that serve children with intellectual and developmental disabilities who cannot attend in mainstream classrooms. What we'll do today is I'm going to start with Dr. Zimmerman. And Dr. Zimmerman, I would really love you to provide just a brief summary of what you're working on there in Durham.
Thanks, Dr. Cernich. So our project here in Durham has really focused on making sure there's access to testing for children. We also want to understand how testing might affect how comfortable people feel going back to school. That's parents, that's students, that's also teachers and school leaders. So we are doing some qualitative evaluation of that. We want to understand how testing affects transmission within schools, and whether or not doing the testing program, surveillance testing and screening testing in particular, can be helpful in limiting the number of people coming in with COVID-19 and therefore the number of people who are there to expose other people.
That's fantastic. And so in doing your work, you had to make some connections around your community. And so Ms. Pryor, how did you connect with Dr. Zimmerman? And what were your concerns for your community during the pandemic when this project was being developed in Durham?
Hello, everyone. I got connected with Dr. Zimmerman through another colleague here in Durham who had heard of the project that she was involved in first and introduced it to myself and other administrative leaders here in Durham, North Carolina. And for me, you can imagine at the time when the project was started, it was very chaotic here. People was panicked. People didn't quite understand the data that was being shown. So when I had a chance to meet with Dr. Zimmerman and her team, it began to provide answers and begin to unlock some of the key factors that we had to think about when creating a plan for our students and faculty, parents, and community.
So when Ms. Pryor, when you were thinking about the concerns that you brought to Ms. Zimmerman, what were some key concerns that parents or students were bringing to you at the time?
At the time, as you know, COVID was all over the television, and I serve a high population of African Americans and Hispanic students. And so the concern for my families were, will I get COVID? How will you all protect my students? What am I supposed to do? What is the school doing to make sure that people are safe? people in the community was coming to us because as the school, they see us as the hub of education. But of course, we had to go to the professionals in the science field. They wanted to know and begin to understand exactly how COVID was transmitted, like what type of safety measures that we could provide.
Perfect. And so, knowing that this is a community engaged program, Dr. Zimmerman, how did you take in these concerns from the community? And how did that help you in terms of planning your research project?
Right. So Ms. Pryor and I actually met in the fall of last year. And so we've been interacting for a really, really long time over COVID in schools. So we've had the opportunity really to connect and to hear the concerns and to together think about how we might be able to approach the concerns. We've even met with her teachers. We've met with her community through PTA meetings so that we could hear their concerns there and that we could provide information back to them. So it really has been a lovely joint engaged effort as we've been moving forward over the last year or so.
And were there things that there were unexpected things that you and your team learned and had to overcome?
I think, as far as the testing program in particular, we just thinking about logistics, right? Like, how do you get people from one place to another? Where are we going to sit? How are we going to swab them? How do we get results back to people? Those types of things certainly have been logistical barriers. But then just thinking about the general fear, the intense fear that has been around COVID, and how do you address that? Like, how do you address that with science? How do you address that with empathy? Because you really have to respect where people are coming from and how fearful people actually are with regard to COVID, especially in our communities.
Yeah, and when you talk about that fear, was the fear just about the disease, or was it about also parts of this related to actually doing the testing, or what happens with my results, or can I trust you all with these data?
Right, it's all of those things. All of them, and Ms. Pryor can definitely tell you. It's about COVID, but it's also about privacy, right? Like, we have these doctors coming in from Duke. They're helping us. They've been helping us all year, but I want to make sure still that they're not going to go show my information to other people. So we've set up some things in our project to make sure that we don't have a lot of information on the children who are testing and their families. A lot of that is governed by the school, and we're really there to help. And then we get additional information later on about how we might be able to, how COVID has affected other people and affected school people as they've gone forward.
Great. So as you all are learning all these lessons, and I know Dr. Zimmerman and Dr. Garnett worked very quickly to respond to our requests for research in this area and got out to the field very fast. What are some of the things that you've learned so far, some of the key lessons that you've learned from the testing programs that you're doing in the school systems?
This is all about relationship, right? Like, I think if I didn't have a relationship with Ms. Pryor and with her community and with the community in Durham, there's no way I should be walking in there and, trying to set up a program to do testing, even if it's supposed to be helpful. So it has been sweat equity, I think, put into this relationship over the last year. But it's worth it, right? This is a community thing. I'm part of the community. I want to make sure that my community is safe, and there are lots of different ways we can do that. And then supporting them outside of the testing too, right? Making sure that they're getting not only testing, but all the other stuff that they need, which is the education piece or other resources that they might need.
And then in terms of the testing, what have you learned from the testing? What benefit has the testing had for the schools, if any?
I think Ms. Pryor might be able to answer better, but I'll say what we've seen is that people just feel more comfortable that people are getting tested, right? They're using it as an opportunity to make sure people aren't coming home to infect their brother or their sister or their grandma that might be at home. We haven't really caught that many positives in our screening program so far, which is great. We're super excited about that. But I think people feel more comfortable that the opportunity is there, that they can easily access it, access the testing. They don't have to pay for it. It's free. It's private. And it's something that the school is doing to help keep them safe.
Perfect. So, Ms. Pryor, I think that Dr. Zimmerman just pointed over to you. What what have you all? What are some of the key lessons you all have learned so far?
Well, the thing is, people were fearful. They were very fearful of COVID. And for us, the greatest lessons that we had was, number one, we was able to have this great access right in our backyard, because sometimes my community are very fearful, people and outsiders coming in trying to help. So it has been able to calm fears down, to allow parents to allow their students to even return back to school, because that was also a concern. How are you going to keep my child safe, and how my child not going to get COVID and return back to school? And for us, we know that our students learn better when they are in school, mentally, socially, academically. So it's very important for us to make sure that we had our students return to school, and being able to be a part of the program offer that security. Like Dr. Zimmerman said, it's like an extra layer of being able to calm some of the fears down in the parents. What we have been very fortunate, and I don't know, maybe part of the program, is that our transmission numbers are relatively low. We just had our first case of COVID this August, and we've been a part of the program since last fall. So for us, just seeing the benefit of, number one, having the testing done, number two, parents trusting us to do that, because we do provide a sterile environment, we provide a safe environment. It's very private. We keep the information very close to us. Not many people have access to it, so parents trust us now. And when we first started, the number of parents who signed up wasn't as many. Now everyone wants to be part of the program because they understand how it works. So we've been able to have all our students return to school. And that's been one of the biggest things that's very successful for us. Having students return to school, have parents to believe in us, and have parents to really turn to us for some of the information has been very useful.
So, Ms. Pryor, just to build on that, I mean, you are a community that has connected with researchers. You're working on a research program related to COVID, and it sounds like dealing with a lot of sensitive issues. And what recommendations do you have for other communities that would be looking to implement a similar program or better connect with the researchers in their community to do something like this?
I do know that Dr. Zimmerman and her program do reaches out to other communities, but my suggestion would be, number one, because there's so much information out there, and it can be information overload, and it can be misinformation. So make sure that you're connected with people like Dr. Zimmerman, yourself, just great, reliable, scientific information. So that's the first thing I always ask people. I tell people, when this was going on, the first thing I wanted to do was make sure I connected with people who knew the scientific information about COVID, about transmission rates, and how to, decrease the chance of transmission, and just having the proper information, because there's a lot of myths out there. Number two, relationship building, making sure that because I'm the one that had the relationship, not Dr. Zimmerman. So it was me who was giving the message to my parents and to the community that I serve. So making sure that you're also connecting with the partnership and letting your face be the one that people trust, help to deliver the message out to the community has been very useful. Those are my suggestions.
That's amazing. So I'm going to say thank you to both of you for sharing what you've learned and your experiences. And I'm going to ask that we transition a bit to Dr. Gurnett and Ms. Birch. And sort of following on to that, Dr. Gurnett, we'd love it if you could just provide to us a brief summary of what you're working on there in St. Louis in the Special Education School District.
Sure. Thank you so much for having me. We're really excited about the studies that Kenesha and Lament are doing in regular classrooms, but we work entirely in a very different environment where we've got kids with particular vulnerabilities to becoming very sick if they were to get COVID. And we also know that the strategies of mitigation strategies of wearing masks are completely different if you've got a room full of autistic kids. And so it was really our goal to go into the school and find out what are the special things you need to do in addition to all of the past information that was discussed, what are the other things you have to do in this special environment? And we were very interested in the communication strategies. How do you reach parents? How do you reach the staff? Because we're also offering weekly testing to the staff. And what are the messages that resonate with them to convince them to make this effort along with us as part of the research study? And one of the particular challenges, of course, is that this has varied over every month of the last year and a half. It seems that we were lucky to get into the schools very early back in November last year when the pandemic was really at its peak. And then obviously seeing waning interest when things get better, and now a lot of interest again as the Delta variant picks back up.
For sure. And, we know that we are seeing more cases in children now, both with return to school and with the circulation of the Delta variant. And so I think that has also propelled a lot of the interest. I guess, Ms. Birch, we know that children with special needs have been really adversely affected during the pandemic, and some of them are even more vulnerable to severe illness with COVID. And so it would be great to know how you know Dr. Garnett, and then also a little bit about what it's like to be a special education teacher during this pandemic.
Well, sure. Dr. Garnett and Dr. Tyler Walsh have been doing this study with our special district schools, and they've been coming in every week and doing testing on us. And for those staff that are willing to participate, they've also encouraged families to have their child participate in that weekly testing too. So I know that they are a part of discussions with principals of the buildings and our nurses, and then sharing information with families. They meet with them weekly, and then that information is trickled down to us. So I've not been a part of every weekly meeting, but we've been part of that communication. So that helps every week. Getting that testing puts a little bit less stress on us. I think we're a little bit more relieved every Monday at 5 o'clock now when we get that negative, especially when we first came back to school. I know every time we would leave school, we didn't know if we were coming back the next day. So we were, carrying everything with us. But I think as time went on, that we've been able to be in the classroom more successfully. I think our anxiety has decreased a little bit. But I feel now that because of the Delta variant, that anxiety's increased a little bit more now that we're back at school, even though we're doing that weekly testing, because any kind of sniffle or headache, you start wondering. So it's reassuring to us to have that testing with them. I can't hear you. I can't hear.
Sorry about that. Zoom, I can't hear you. Can you unmute? I think the question that I think people ask, there's all these things about, should we mask, should we not mask? And you're really in a setting where some of your kids, it really is difficult for them, because of thinking or emotional or behavioral or physical needs, that they can't do some of the things that we suggest, like distancing. They can't do masking because of respiratory concerns or other concerns, or they have, potentially you have people in your setting that have respiratory needs. What's it like to be in that setting as opposed to a regular public school setting? And what are the challenges for you all in that setting?
Well, I think initially there was a lot of apprehension. We were very nervous because we are very hands-on. Our students, like you mentioned, are in my building are 5 to 14, and they need more intervention than they could get out in a public school setting in a special classroom. Some of our kids are very medically fragile. We need hand-over-hand assistance for whether it be just toileting or feeding or fine motor skills and or social emotional because of behavioral needs. So there was a lot of apprehension, I think, for staff on whether or not we were going to be safe and or were students going to be safe. My students, it has surprised me that, that's just one of our rules, masks on, when we go out. If we're in the classroom, all of my staff has been vaccinated. So They take it off for, when they're eating. We try to keep socially distant in line and also in the classroom. So we've been pretty successful and made it through the entire year without having to quarantine. So that does help make us a little more at ease. But some of the other classrooms where students are medically fragile, our autism students who have a lot more sensory needs, it is very difficult. Because of bodily fluids, you're just constantly hand washing. The PPE that's been provided for us really does help, because we have anything that we need as far as gloves and wipes and things like that to help us, put us a little more at ease.
So I think that really helps the context of all of this. I think, Dr. Gurnett, knowing all of these challenges that these families face, how did that influence the way that you designed your project? And were there certain things that you prioritized or addressed first to really serve the community?
Yeah, so we were really fortunate around the time we were looking into this project. Washington University Genome Institute had developed a saliva-based COVID test. And we feel that that's particularly helpful to use in this population because you're not coming at the kids with a NP swab. I think the parents have been more receptive, knowing that we can either have the child spit into a cup to collect the saliva, or we can use swabs to collect in patients that are not, or in students that are not so cooperative. And so I think, having some more flexibility in the testing may be something that would be more helpful out in the general community, as a lot of people have these same fears, and that does seem to be something that limits testing in some populations.
Yeah. And so what have you found so far in your research, and how can other schools or families that serve children with special learning needs or special medical needs maybe think about applying what you've learned?
Right. So, it's been such a great collaboration with the teachers and the school nurses, because they've really taught us everything about how to apply mitigation strategies in these schools. So we do know that in addition to masking, when the kids can't mask, we do encourage, especially when there's high rates of COVID in the community, we encourage the teachers to use face shields as one other protection that they can use in the absence of others not being able to mask. And we also just know that the schools we've been working with, the teachers are tremendously devoted, and the administration's tremendously devoted to safety. And so it has to permeate everything that they do, and keeping kids in pods, small pods, so that transmission is less. And fortunately, we've been able to really document last year during 26 weeks of testing, we really only had one, maybe two cases of transmission that occurred in the school. And that was during really, really high levels of transmission in the community. The other thing that we were really fortunate to find out is that the infection rates in the school were really no higher than what we saw in the community, based on our testing that had been done at Washington University, kind of surveillance in the schools there. We found that these schools don't seem to be any higher than levels that you see in the community. And so that should be somewhat reassuring that schools are equally as safe as what's happening all around us otherwise.
Awesome. So, Ms. Birch, it sounded like, what you're hearing and experiencing with respect to the research project is some of the results. What's been helpful to you, and what do you see are the needs that we need to think about for this research that we need to tackle next, that need to be on the agenda for us?
Well, I think, of course, getting more people vaccinated, whether it be staff and families, because I know there are staff that are still not vaccinated here, and they're going to have to quarantine should they be exposed with that. I think just communication to families is difficult for our families in where my school is located. Some of our families don't read an email. They may not be able to read it all. So I think when we're communicating, we need to really talk to them in layman's terms so that they can understand, because when we're using big words and big terminology, it makes it more difficult for them. I think just, like what the other teacher said was just building that rapport and that trust, with our families and letting them know that, we are vaccinated and, we wear masks. And I try to encourage my families to have their child participate in the weekly testing. And one of my students is now doing that. So I think, even though parents are getting tired of COVID and hearing it all, the more we can tell them that we can and show them that we can be successful and that we have all these safety protocols in place, and just trying to communicate and get them on board with us. I think, that's going to help the year continue to go smoothly.
And I'd like to actually open this question back up to not only to you, Ms. Birch, but to Dr. Zimmerman, to Ms. Pryor, and to Dr. Garnett. And I think you all have really highlighted this. And, I'm a parent of school-age kids myself. And so communication for me is super critical. What's the protocol? What's going to happen at the end of this testing? How long will my kid be out? What do I have to do to get my kid back in? Right. And I think that these are things that are so critical for parents, but also, for me, knowing the teachers are vaccinated, knowing what protocols are being used, what's happening at lunchtime and the like. Can you talk about sort of what you think that the key things that we need to really think about as we're thinking about, what do we need to do to help support with research and evidence in the community right now? If you could tell me just in this last couple minutes, what would be your number one, I'd appreciate it.
I think for things to be a little more defined, where last year everything was a little more black and white because we knew that at this time last year, no one had a vaccine. And I think for us now, you're talking to people or interacting and you don't know, have they had the vaccine or not? And what's going to happen if we are exposed? I think that has a little bit of unrest for teachers working with students.
Thanks, Ms. Birch. Others, anybody else? And you don't have to if you don't want to.
No, I would say the number one thing really still to emphasize is vaccine.
Okay. Perfect.
I would definitely
on vaccine. Got it.
Would definitely agree with that, but I think we're in really tumultuous social setting and political setting where even enforcement of the basic mitigation strategies that we know work has been controversial, unfortunately. And so I think understanding ways that we can still mitigate while all of this is around us, and understanding what the true consequences actually are from a decision that's made, or at what point can we actually pull back from some of the things that we're doing? Is that community rates? Is that vaccination rates? Is that infection rates? As far as how many people have actually already been infected. I think answering those questions is really critical as we continue to move forward. In addition to vaccination, agree that's 100% the first one, but we also have to think about these other things.
Yeah, and I agree with Dr. Zimmerman, making sure that the message still stays simple, because now on the school level, is so many different ways that we are looking at. Are you exposed with a child wearing a mask? What's exposed to a child not wearing a mask? Are you 3 feet, 4 feet, 6 feet? It's just so many. Are you vaccinated? Are you not vaccinated? And it's like we've turned it to the COVID police now. So it's like just making sure that we keep the message, still simple, still basic, still we know vaccinations work. We know masking work. We know, washing your hands still work. You still have to do those things that we know have been successful at keeping the transmission rate down. So just keeping the message still simple, even through all this that comes out.
What I love is that you all have been those messengers today. And I really want to thank you all for being part of this engaging discussion, and to all of our panelists for joining us today and bringing these very important voices. This topic is incredibly important as we move into the fall. So if you'd like to learn more about RADx-UP or any of the NIH testing programs, you can visit the links that are posted in the chat. And I really want to say again, thank you for joining us, and thank you so much to our panelists.